You're listening to Civic from the San Francisco Public Press. Decades of effort to combat chronic hepatitis B infections could soon leap ahead.
The study will be able to result in a negative hepatitis B surface antigen, what we call a functional cure.
Or treatments could be thrown backward by the Trump administration.
Chronic hepatitis B is a global silent epidemic that is underdiagnosed, undertreated, underfunded, and stigmatized.
I'm Mel Baker, and this is Civic. In 2001, Dr. Mark Stephen Lim had finished his residency training and was about to begin his career in San Francisco when he discovered he had advanced liver cancer and only months to live. He was diagnosed with chronic hepatitis B during his medical training in the early 1990s, but was told by the very doctors training him that he didn't have to worry about the disease progression until he was middle-aged. He died in 2002 at the age of 32. His death was part of a wave of unexpected deaths among young Asian Americans with chronic hepatitis B infections, which shocked San Francisco and sparked grassroots movements focused on awareness, expanded screening, and coordinated action. 2 decades later, more than 305,000 Californians are believed to have chronic hepatitis B. 104,000 in the San Francisco Bay Area alone. There are believed to be 296 million people living with chronic hepatitis B worldwide. If left untreated, it can slowly damage the liver over decades of time, leading to liver cancer, liver failure, and death.
I'm Assemblywoman Fiona Ma, along with Giants outfielder Dave Roberts, and we have an important message for you. Hepatitis B is the leading cause of liver cancer and claims
the lives of one person every 30 seconds. It's a scary fact, but one that can easily be changed. There is an effective vaccine and treatment available that can quickly curb this deadly cycle. Most people who have hepatitis B are completely unaware they even have it. The first step is knowing. So get tested today. It's simple and affordable even if you don't have insurance. Don't let what you don't know kill you.
Local public service announcements like these in the 2010s were aimed at the Asian American and Pacific Islander population. In San Francisco, a recent report from the Department of Public Health found that in 2023, 85% of newly reported cases were among Asian people, down slightly from 89% in 2012. Asians and Pacific Islanders comprise only 35% of the city's population. Part of the problem has been social stigma, which discourages getting tested and leaves patients isolated and unwilling to open up about their experiences. Wendy Lowe is a patient advocate for those living with chronic hepatitis B.
I was diagnosed with chronic hepatitis B during my senior year in college. I was 21, getting ready to study abroad in mainland China, graduate abroad from UC Berkeley. And in your regular, preparation to do a medical screening to go to China, I actually found out I was, I'm Hep B positive. I was going to get a vaccine, but since I already have been exposed to the virus, the vaccine would not do me any good. This is back in 1994, so we're talking about 31 years ago. At that time, there's no real treatment.
Tony Lau immigrated from China, and for most of his life in the Bay Area, he rarely visited a doctor. Like Wendy, he was diagnosed as an adult.
I found out I got happy when my wife was before we got married, we got to do physical tests. I think it was my first time having my blood test, and then I found out what's going on.
Lau's doctor told him he couldn't kiss his children because he might transmit the virus and offered him no hope and that he would likely die in his 40s.
The only cure is when all of you die. There's no cure. When all of you guys die, then there won't be any more Hep B person, because everybody who was born after 80s, they are all vaccinated already. So that was the plan, and that's what basically gave me okay, that's a death sentence. I'm done, right?
Luckily, a liver specialist at UCSF reassured him that daily medications could suppress the virus, limit liver damage, and greatly reduce his risk of transmitting the virus. Hepatitis viruses can be transmitted through sex, contact with bodily fluids, blood-contaminated objects, such as toothbrushes and needles, and from mother to child during birth. While most adults who are exposed to hepatitis B go through an acute phase with symptoms such as jaundice and extreme fatigue, only 5% go on to develop chronic, symptomless infections. The opposite is true for infants who rarely express acute symptoms but have up to a 90% chance of developing a chronic infection. Many researchers believe the high rate of late-stage chronic hepatitis B among younger Asians, Pacific Islanders, and Sub-Saharan Africans is due to this cycle of mother-to-child transmission, often through multiple generations. But we do have ways to disrupt this kind of transmission with vaccines and effective treatment regimens. A hepatitis B vaccine has been around since 1981. And for those who already have a chronic infection, daily pills, some of them first created to control HIV, have been able to suppress Hep B since 1998. However, there has never been a cure for chronic hepatitis B, but that could change in the next few years. Numerous studies are underway to create a cure for chronic infections, including an international clinical trial by the pharmaceutical company GSK, with an arm in San Francisco. The key to the B United trial involves 2 new injectable drugs administered over 6 months of time, followed by another drug taken in pill form over the next 6 months.
So my name is Maurizio Bonaccini. I'm a physician and I'm a specialist in gastroenterology and liver diseases. I'm the president of Mission Gastroenterology and Hepatology, and I'm partnering with Quest Clinical Research to run clinical studies in several liver diseases, among which hepatitis B. Why are we doing this study? Because the study will be able to result in a negative hepatitis B surface antigen. So we don't only suppress the viral DNA, we really clear the virus. What are the advantages? Well, they're twofold. One is that we know, because it has been shown, that the chance of liver cancer will decrease a further 50%. A patient would have 10% chance of developing liver cancer. Get the surface antigen to be negative, the chance will be now 2.5%. So it's a 75% decrease, which is better than the current medication. This is number one. Number two is that probably we'll be able to stop you from taking the medication that we give to patients to suppress the DNA. So they will be able to come off medication because they'll be cured, what we call a functional cure.
Bonaccini is eager to recruit Asian Americans and Pacific Islanders for the study because their chronic infections are more likely to have taken hold when they were infants, making them the hardest cases to cure, and therefore the most important to test new therapies on.
This double combination that we give at the beginning really suppressed the virus significantly in basically 90% of patients. So it's basically a double whammy, right? You give 24 weeks of this medication to decrease the surface antigen so that this second medication, the bepirovirsen, can be more effective. But what they're giving us is that they expect a cure rate that will go from 20% at the lowest end, so maybe Asian patients with high level of virus, to 50%, which would be huge in the hepatitis B world.
Regardless of how someone was infected or how long they've had chronic hepatitis B, researchers hope that by hitting the virus with 2 injectable drugs followed by a third in pill form will lead to a cure for many patients.
So we know something that's almost accepted as dogma right now, is that in terms of losing the surface antigen and achieving a cure, patients that are Asian will have lesser percentage of cures than non-Asian patients. And that is probably because they had the disease longer, typically from birth, and there may be a difference in which the immune system may react. Because at the end of the day, we believe that the immune system has something important to do curing the virus versus not curing the virus.
Bonaccini says that the clinical trial results could be ready by 2027, but across-the-board cuts to the FDA by the Trump administration could slow any approval process by several more years. Patient advocate Wendy Lowe is also worried about federal funding cuts.
In the CDC, this was just in the news, the last few weeks. One of the cuts they did was they dismantled the Department of Viral Hepatitis lab. The CDC has a lab. In other words, anytime researchers or anytime any state level where they detect some kind of outbreak, right, they can send some samples to this lab, and the lab will do the testing for, at no cost. So, and then they will provide, is this something new? Is this a different permutation? And they do that for even the CDC lab does it for overseas too. That lab has now been dismantled.
The Trump administration's decision to slash medical research funding is reminiscent of the way the Reagan administration refused to adequately fund research into HIV in the 1980s. San Francisco General Hospital's Ward 86 became the model of care for HIV/AIDS in 1983. Then, as now, it has been local medical professionals and patient advocates who are developing a model of care for hepatitis B, regardless of federal support. More than 40 years later, the Asian American and Pacific Islander communities of the Bay Area and local medical professionals have been creating their own programs for combating chronic hepatitis B. My colleague Jia Wu has been reporting on the role people in San Francisco played in developing the new standard of care.
It kind of started after a wave of young Asian American dying way too early, bring a lot of concern, mostly among the community and also among this one physician. He's a liver transplant surgeon called Dr. Samuel So. He started out a campaign called Jade Ribbon Campaign, trying to raise more awareness because this is something that could be avoided by screening it early enough or vaccinating people who have not had hepatitis B vaccines. So he started laying out some of the groundwork, starting a center called Asian Liver Center and working with a lot of the people in the community to kind of bring more awareness to it and do all those kind of health fair where you table out and helping people do a blood draw and see if you get hepatitis B or if you are qualified to get a vaccine. So that actually have influence both locally and internationally. His organization, Asian Liver Center, later helped with some other group in China to develop some early groundwork of bringing more vaccinations in some of the poorest provinces in China. Within San Francisco, around 2007, that's when a lot more local community kind of come together. You have Dr. Samuel So collaborating with some local representative in the local community hospital and local community leader, SF Department of Public Health, and they all come together and create a coalition called San Francisco Hep B Free. This loose coalition where they bring those very important people from different fields, like from the government or from the hospital and activists together in a table, and they have meeting every month and figure out way to provide more charity care, which means free kind of testing. And they also do a lot of outreach, public awareness event, and also educating the doctor. This is hepatitis B, and this group of people are very high risk of it, and you should try testing them when they come to primary care. So this is a mostly community-based movement that to bring more awareness and education within the community. And it also kind of spread nationally because they are able to get some grant that to put up a advertisement campaign.
So Hep B Free spun off to be a nonprofit, and that's what it is now. And they are literally trying to replicate this model they developed that you've described and help other communities around the country create their own version of this in their city.
Yeah, and that's kind of tied into that history that they there's one times that they has been so influential that in other city also developed their own organization, like New York Hep B Free, LA Happy Free, and you can still see some of those organizations are still thriving, but then not all of them, because like hepatitis B is still a very under-resourced illnesses, and many of those organizations, many of them are nonprofit, running out of funding, and some of them disappear over the year. And what they are doing now, San Francisco Happy Free, is the kind of like the founder of this like Happy Free kind of coalition model. They renamed it to just Happy Free, and trying to kind of like bring a lot of those initiatives together.
Hep B Free San Francisco is allowing other nonprofit organizations to use the template of its website to create their own model of care centers. One key part of Hep B Free's model is cultural competency. Wendy Lowe explained to me and Jia how hard it was to find community and appropriate care for her chronic Hep B when programs and services didn't feel like they were for her.
When I was diagnosed in 1994, I was looking, this is a little bit before internet, it is before internet, but I was looking for a support group. They referred me to the Veteran Association out in Richmond for chronic hepatitis C, not B. It didn't exist for B. And I went there, I was 21, and I see these people who are middle-aged, and they were on the interferon medication, and they complain about how bad it was. They couldn't hold their job, couldn't hold down their food. It was fatigue, you know. I ran from that. I ran away. And it actually created more fear for me to live with the disease than not going. But my point is, there wasn't any resource for chronic hepatitis B.
A quick side note, interferon is an immune-boosting drug used decades ago against HIV and hepatitis B and C, with little effect but devastating side effects. Now back to Wendy.
I pretty much lived with it in silence for about 28 years. Back in 2022, there just happens to be I think it's called FDA externally led patient-focused drug development study. It was in 2020, and it was right at the start of the pandemic, and so I was home, and I said, okay, let me go join online. I participated, they asked questions, and for the first time, I actually heard someone else who has chronic hepatitis B share their story. I remember how much of an impression it made on me, so I decided to share my story. You know, you do a little video, a project. And my plan was to, take pictures of me young, my family young. I would just use my first name. Nothing would be identifiable. After doing the story, I did get invited to speak publicly on World Hepatitis Day, July 28th. And I did, with a lot of hesitation and mixed emotions. But that was really my big springboard in terms of the first time that I share my story in person, publicly, and just feeling very vulnerable. After that, one event led to another. That has kind of led me to becoming a patient advocate. I've been involved on both the science, I'm very interested in the curative research side. I'm very connected to the community.
Wendy has been following the Be United trial described by Dr. Bonaccini as well as other potential cures, but her main work remains in her community.
There's already a stigma. So when I go to speak to the Chinese-speaking community, there's generally already an awareness of 肝炎, which means liver disease, and they generally refer to hepatitis B. Okay. Because it's been around, my parents are aware of it, generations. And the thing is, there's a lot of misconceptions about how it's being transmitted. From the idea of physical contact, being in proximity, sharing food, touching, So there's a lot of stigma and almost exclusion. Families that have someone diagnosed with hepatitis B, that person will eat separately from the food and not mix. Like Chinese families are very into family eating, family style, right? Where you pick food from a shared dishes, but they would separate it. And the person's dishes and utensils would be separated. Think about COVID quarantine. It's a little bit like that. So there's that misconception. And then there's misconception about it being hereditary. So if you're diagnosed with it, other families might not want, for date or marry because they see that it's being transmitted. But majority of the transmission globally is actually from mother to infant at birth because there is blood exchange. Until there was the science behind it, they just see, it seems to happen in the family. It must be hereditary. These are some of the misconceptions.
I think that's very interesting because I actually heard about that. Like, I heard about don't share a chopstick, don't share food, because of that exact reason. I think I didn't even know that that's a misconception. But then it's like that kind of show how profound that become. I think, and
Yeah.
Yeah, and I think going off on that, I think something that you say I found to be very interesting is like the kind of like silence it got, like this being silent and you also being in silence with this for a while and finally decided to break the silence.
Yeah, so I'm gonna come back to these two words quite a bit. Context matters. Because when we understand how it's come to be to this moment, so one big piece that I think you touch on, and I'm going to unpack that, right, is I say this. When we say chronic hepatitis B is a silent epidemic, there are two sides to this silence. One is, yes, the disease, by and large, people like me and some others, you can live your life day to day without symptoms, meaning the liver doesn't have any nerves. It's while it's going through inflammation and scarring and cell damage, there's no nerve cells that's telling you, hey, I'm in pain, right? So by the time that usually people who, if they're undiagnosed and all of a sudden they have either pain or jaundice, which is yellowing of the skin, or abdomen getting bloated, ascites, a lot of the symptoms, that's actually very late stage, where the liver has already sustained a lot of damage over the years or decades. So that's one piece of the silence that from a liver disease standpoint, right, it's silent. But the other aspect of it is what is I really want to, and I speak a lot to, is the psychosocial factors, sort of this cultural piece of it. And it has to do with the stigma, the misbeliefs, misconceptions, and the attitudes for hepatitis B, right? So as an example, what you just said there, I've heard of that growing up, that we don't share chopsticks, if it's in a Chinese American family. You kind of know about it. There's a lot of assumptions that were there, right? But no one, I know at me as a first generation Chinese, anything that is, we don't share things that that doesn't reflect well in the family. For me to do what I'm doing, to speak out individually, that if for my parents, for my family circle, that is it's not just calling out for me, but it's a reflection of this wider circle. So we've had cases where some younger generation of people with Hep B, they want to share, but then when the parents or the grandparents or the relatives will say, don't say anything, right? So that's one of the invisible web of influence that is not being talked about. I think in the U.S., right, there's a little bit more of an individualistic. I'm going to say what I feel comfortable is just a reflection on me. I'm going to bear the responsibility. For where I come from and where I grow up, in a lot of the communities, right, whether it's East Asian culture or even actually a lot of cultures outside of the individualistic culture that is more assailant in the U.S. It's group, it's social, right? So what I do can reflect positive or negatively on my social circle, and that actually can keep a lot of things reinforcing the stigma, the silence, and creating harm. At the end of the day, there is harm that is being perpetuated. This is the reason there is not enough political will, awareness, general awareness, and even just community groups, right? Support groups to help people living with Hep B.
There has been progress over the last 2 decades, at least at the local level. At clinics like Northeast Medical Services in San Francisco, where many Asian immigrants receive care, universal hepatitis B screening is already routine. A new California law mandates that health insurance companies cover hepatitis B screening tests. New Centers for Disease Control guidelines issued in 2023 call for universal testing of all adults at least once in their lives, but that often depends on a provider's knowledge of the current guidelines and their personal judgment about whether a patient is at risk, leading to possible gaps. Federal funding for hepatitis B programs have lagged in comparison to other infectious diseases. The U.S. government has dedicated approximately $28 billion a year for HIV prevention, treatment, and research, with the majority of that to support people living with HIV. Specific funding for hepatitis B has varied from year to year. It was just over $800 million a year during the first Trump administration. Both hepatitis B and HIV face severe cuts in the Trump administration's 2025 budget. Wendy says her hepatitis B activism is driven by a lack of awareness and resources going back decades.
For hepatitis B, two-thirds of the people are undiagnosed in the U.S. as well as globally. So majority of people are not. And if you look at those people who are under treatment, right? I think in the U.S., I remember one stat, I think it's a little older, 2006, but it was saying, 40% of the people with HIV are aware, are in care. But if you look at hepatitis B, we're talking about just 4%. Part of the reason I speak up and speak out is I feel like I'm the lucky 4%. I was diagnosed early, right, at age 21. I've been lucky to have access to the treatment. I am, savvy in terms of health literacy and have access to care. I have insurance. And so I have been on this medication that has been helping me to lead, extend my life, right? Help delay potential liver complications and liver cancer. It doesn't prevent it, but at least help. So I feel like I'm one of those lucky few who needs to speak up and speak out, because there's so many people, whether it's in the United States, right, who live in immigrant or marginalized, underserved communities, and globally, a lot of people who needs this medication or who needs better attention are not getting it.
As the trial for a potential cure advances and the Trump administration cuts funding for research, the fight against chronic hepatitis B continues to be an uphill battle. But advocates like Wendy have made progress, especially in expanding screening. Now they're taking the San Francisco model of care to other cities to get testing, medication, and support for people who need it. The reporting for this episode of Civic is supported by a grant from the Pulitzer Center. Jia Wu's reporting of hepatitis B is also supported by a 2025 California Health Equity Fellowship from USC Annenberg's Center for Health Journalism. Civic comes to you from KSFP LP 102.5 FM in San Francisco, a project of the San Francisco Public Press. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. Find this episode and our companion articles at sfpublicpress.org. New episodes drop on Thursdays. I'm Mel Baker. Thanks for listening.